Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. In this video, we're going to talk about endocarditis as well as Buerger's disease. So let's start with endocarditis. So endocarditis is actually inflammation of the inner layer of the heart due to an infection. So the heart is actually made up of three layers: the epicardium, which is the outer layer, myocardium, middle layer, as well as the endocardium, which is the inner layer. What is cause of endocarditis? Actually, endocarditis is caused by a microbial infection to the endocardium, which is the outer layer, which can only get there, or somebody can only get this through a bloodstream infection. And how do you get this bloodstream infection? It could either be to a wound infection, a dental procedure, infected needles, or substance abuse. Most affected valves with endocarditis are either the mitral valves and the aortic valves. Some risk factors for patient actually ending up with endocarditis include prosthetic valves, makes sense, prophylactic before a procedure, congenital heart defects, rheumatoid heart disease, as well as intravenous drug abuse. And this is actually the most common cause of our left side endocarditis issue. Some signs and symptoms of endocarditis include fever, mema, septic embolies, some Roth spots, as well as glomerulonephritis. How do we diagnose a patient with endocarditis? We'll have to do some various or several blood draws to check for positive blood cultures, right? Remember, it's a microbial issue. We need to draw these blood draws, do the cultures, so we can actually use those blood cultures to do a treatment for this patient. And we can also do an echocardiograph. So treatment for this patient will include a prolonged use of antibiotic depending on the causative agent. That's why we are doing sensitivity, so we know what the microbial reacts to what. We can do surgery for several causes, like if it's a valve dysfunction or heart failure or multiple embolism. We could also do a surgery to remove that prospective valve if it's infected. Prevention for this. We can prevent this by the use of antibiotic prior to dental procedures or patients who are at high risk prophylactically. So this patient who are at high risk for getting endocarditis include those patients with history of heart transplant, patients with history of endocarditis, as well as prosthetic valves. There is something known as the Liebman-Sachs endocarditis, which is lupus. It is not an infection. It's not infection related. It is associated with lupus, the systemic lupus issue, which is an autoimmune disease involving antigen-antibiotic complex, which settles on the endocardium, causes endocarditis. So there is a Liebman-Sachs endocarditis. This is not an infection-induced, it's lupus-induced, right? It typically occurs on the mitral valve, causing regurgitation. It could also happen in the arterial endocardium and ventricular endocardium. So there are two types of endocarditis. There is the one which is infection-induced and the one that is lupus-induced. Where the lupus is not cause of an infection, it's cause of the lupus, which causes antibodies that causes some settlements in the endocardium. So let's talk about Buerger's disease. It's a thrombonephritis issue, right? So Buerger's disease is a recurring inflammation of the arteries and the veins of the lower and upper extremities, resulting in thrombus with occultation. The cause is actually unknown. Some causes, what they think that it could cause Buerger's disease include, it's thought to have a genetic predisposition. Some people, it's genetic, hereditary. Smoking, as I told you, smoking is in every disorder. Chewing of tobacco use. It occurs most often in men, so it's predominantly seen in men ages 20 to 35 years. So our signs and symptoms for this disorder include intermediate pain in the legs, feet, and arms, in these extremities that are not getting, they're inflamed, right? Pain eases when activity is stopped, claudication. Inflammation along the vein below the skin surface due to a blood clot in the vein. Cold sensitivity of the Raynaud type frequently occurs in the hands. It's painful, painful open sores on fingers and toes, you will note. And ulceration with amputation are common. So patient could lead into amputation due to this Buerger's disease. What are some interventions that we can do for this patient? We'll promote smoking cessation, we'll avoid cold or constrictive clothing because these things interfere with perfusion. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.